are captured. First, we will go through announcements. I only have one, which is just a reminder that next month we are taking a break from these meetings, so we'll be in August. Does anyone else have announcements? Nope. So now we'll go to reviewing and approving the meeting minutes from April and May. So we have 6 sets to review. Enrique, do you have the files for the meetings, for the minutes available for us to like scroll through, or do we to?
And so.
Okay, well then, did everyone have a chance to review the meeting minutes? Okay. So. Jason, if I send them to you, will you be able to forward?
Do you need the,
We just need the minutes for the screen and we need the, yeah, but I have them handy. Okay, thank you.
okay, I'll share it tomorrow. Okay. Maybe you just minimize yours, like. So.
Great, thank you. Okay. So this is the May 1st meeting minutes, so I think we're a little out of order. And if we can just scroll through so that folks get a chance to look over them.
Yeah, I'll switch here.
It should be on the email. Of the use. And also the shared drives. Yeah, and then my shared drive too, because there is a folder form. Are you not?
Alright, this is great right here.
Oh,
Yeah.
thanks. So these are the ones from April 8th. I think that my only. Let's see. For April 8th, I did not have. notes.
Are there multiple April 8th?
Yes, because it was so it met in all through April and into the first week of May. We just basically recessed and reconvened the same meeting.
So we're doing the first.
Yeah, the first April 8th.
I propose they be accepted or approved.
A second. All. Do you need?
No, nobody's looking at it.
Oh, you're good. Okay, so all in favor of approving the first set of minutes from the April 8th meeting? Say aye.
Aye.
All opposed. So the motion passes. So now we need to look at the second set. April 16th. Then. For me, I think the only. Change that I would like to suggest is that. I think Christy Molat's last name has two T's at the end, so there's one.
Is this for April 16th?
Yes.
Mhm.
I think it's the same on the 27th also.
I'm motion for approval with the needed correction, the spelling of Christine Malat's last name.
I'll second.
All in favor, say aye.
Aye.
Any opposed? So that motion carries. Then we have. See, the 27th. I believe Commissioner Jacobs said that. We need to change the spelling, Kristen Lott's last name, this one as well. And then I'd also like to note that Lofton's first name is spelled.
Yes.
It's I.
Mhm.
And then another note that I would have is that, I think that. TRI's acronym under strategy 7 should be together for resilient youth. It says. Triangle resilient together.
Mhm. Yeah, that's correct.
I'm sorry, what was that? Are we on the 27th?
Yes,
Mhm.
yeah, so under strategy 7. In the discussion. Try is listed as. Triangle resilient together, and it should be
Oh,
together
okay.
resilient. I would move to approve these minutes with those three corrections.
I second.
All in favor, say aye. Aye. Opposed? Right, motion carries. All right, now we're on May 1st. I would note that Lofton's name needs to be corrected in this as well.
Trying to be corrected again,
Okay,
under number 3, previous thing, relation.
I would move that we approve these minutes with those two corrections.
Second,
All in favor, say aye.
Aye.
instead of on.
Oh, May 1st.
I'll abstain since I was the president.
Okay. So motion carries. And then finally, May 11th. I would note that we need to change Lofton, the spelling of Lofton's name in here. And I was fully absent from the meeting. I was not able to join late.
Mhm.
So that needs to be removed where it says join later.
Yes.
I make a motion to accept the May 11th, minutes.
I'll second.
Second,
All in favor?
Aye.
Opposed? Motion carries. Thanks, y'all. So now, if you don't mind, do you mind putting up the slides again, going to slide 3? Thank you. So, do you mind going to slide 3? Oh, that's just a sign.
second.
Thank you. So now we'll go into our debrief of the funding recommendation process. Shalisa and I talked through some group agreements that we'd like to suggest, and we're happy to add any that folks would like to add. But first, we would like to ask that we all give each other grace. none of us is probably gonna remember everything perfectly. We might misspeak, but just know that we're all here because we want the best for Durham. The second suggestion is that after speaking, allow each board member to respond to the prompt, so like, just give everyone a turn to speak like per prompt before speaking a second time. In the interest of time, if you agree with what someone else has said, just say, I agree with them, and focus your speaking time on adding something new or ideas. And then lastly, please, let's orient our comments toward process and refrain from discussing specific proposals. Does anyone else have suggestions or want to talk through? Okay. So let's get started. I'm gonna pull up the questions that we sent out so that I can refer to them. First, we had hoped to discuss what went well in this process. So the first set of questions would be, what specific committee actions or decisions supported our ability to make recommendations about the FY 2027 opioid settlement funds? And how did these actions or decisions support our overall goal? And if you want, also, maybe you could speak to what resources and information we had that was supportive of this process. And we can start with Dawn.
I'm sorry, can you read the?
Yeah.
One more time?
Yeah, what specific committee actions or decisions supported the members' ability to make recommendations about the 2027 funding year opioid settlement funds? How did these actions or decisions approve our sense of overall goal? And what resources and information did we have that was supportive of this process?
Not sure, understand your questions. Read one more time.
Yeah, so the first one would just be, what specific committee actions or decisions supported the OSAC members' ability to make recommendations about the opioid settlement funds?
Okay, so, for me, I thought, the process of understanding what the strategies were that have been identified as to what funds should be used for to attack. And then, having the opportunity as a member from this group to actually view the applications that have been delineated as addressing those strategies, I think, for me, gave me, what I needed along with the persons in that group to make recommendations as I understood them to be as to how those funds should be dispersed.
Paul, did you have anything to add?
The only thing that would be different, but I'm not gonna echo what Dawn expressed, one was, we showed up. No, that's maybe obvious. So we were here, and then also the fact that we had, when there were some challenges, we had ongoing meetings to try to sort stuff out. We really kind of identified what concerns needed to be addressed, and we did that, I think, with integrity and commitment, because we had met multiple times to do that. I do want to echo the general strategy part. That certainly helped me have some sense of, kind of what would fit, what would fit. I would also echo.
Paul, can you speak up a little
Yeah,
bit?
I'm sorry.
I'm hard of hearing.
No,
I wear
no,
hearing aids.
I understand. So, and I think you talked about the process that three of us participated in, and that was really, as one of the participants, I can tell you that gave the three of us an opportunity to really study and understand his proposals, and we had some metrics by which we could determine, how consistent they were with what I thought our goals were. So I'd say that part of the process for me anyway, it was intense, but it was also, I think, very effective in terms of the fact we had some consensus, and I also, we had a lot of information, we had all these proposals, and we had some guidelines by which to evaluate those. So I thought that was, as part of the process, I thought that was actually pretty good. And how these actions support the overall goal, everything was steered in that direction. I guess that's all I'll say for right now. What resources and information that we have, again, the general strategies, some other things that we'll talk about. That we, it's a learning curve. That's the other thing. I thought, we kind of gave ourselves grace for the fact that it's the first time we ever had this process. And I think we, rather than fake it, we pushed through. So I do want to highlight that.
Thanks, Bob.
I agree with everything Don and Paul raised. Those were all helpful things for me. Love that the MOA is so clear and specific with the strategies. I think that is very helpful for every county that's trying to go through this process rather than trying to start from the very beginning. What would be helpful from the MOA. Specifically, what was helpful for me was having clarity and guidance around conflicts of interests among members and how we can participate ethically when we have conflicts of interests. So I appreciated the leadership and guidance of Shalisa, Brittany, and Jason working with the county folks to make sure that we all understood exactly how to, we had the conflict of interest training, but how to apply it in specific situation and reviewing and recommending the proposal. So that was very helpful for me. It's something that the next time we have a go around, especially because I'm sure we'll have at least one new person on the committee, being able to have that specific guidance up front, I think will be very helpful.
Thanks. I agree with what both said. I felt, as someone who wasn't part of the smaller group, that having access to y'all's comments and scores and thoughts was really useful for me. In conversation with what I was thinking and interpreting from the application, so it's really helpful and I really valued that. And I think that's all of that.
Yeah, I agree with what's been said. I think it was helpful to hear the presentations from the groups who were already funded, just to get a sense of what was already kind of being done. And yeah, I thought just the opportunities that we had to discuss as a group, whether the small group that was reviewing the proposals or when we kind of were discussing in the larger group, was helpful, just because there were definitely times when I had questions about what was being proposed and whether this thing made sense or whether this was really a gap or whether, something already was doing this work, and I didn't know exactly how to get that information just on my own. So kind of having the group discussion, I think, was helpful.
I agree with what's been said so far as well, and I would say also just from the beginning, when we formed as a new advisory committee, hearing from the technical assistance team from the state level, who just basically provided us with that overview of what our charge is and how this process is supposed to work, was very, very helpful for me. I think also having that first meeting in April, when we heard from Dr. Jenkins, the health director here, who basically affirmed, for us to do what we felt was the best as far as making recommendations and just being very supportive in that whole conversation of us thinking about how to support the current grantees and the whole thing around the community, the community-based groups and everything. I thought that was a very helpful conversation for me. You just don't really get sometimes that level of just support from someone who also organization is a part of the possible funding. So those are the two things that I would point out that are a little bit different from what's been said so far.
So I agree with with what everyone has said. I think some of the positive things were, I just think the leadership, Jason being very responsive and obviously working very hard. And just the leadership of both you, Brittany and Shalisa. You worked incredibly hard as a volunteer on top of, all of your other work that you have. And so especially with the many meetings. And I just think people showed their commitment, like everyone really cares who's on the advisory committee. It's obvious that everybody really cares about this issue, is passionate about this issue, and is taking it very seriously. And for me, when I was, going through about, when we changed the process and everyone was involved, I really looked at all the comments that everyone had put on that spreadsheet, all the work that had been put in. So thank you to everyone who was on that committee. Because I really read everything that people had written. And also the rubric, the scoring rubric that you all used and came up with those. I mean, that's what I used for my decision making, was that information. So I appreciate having had that to help us. So thank you for all the work that all the committee members put into that, including staff. Who were on that. Kristen, you were part of that too, right? Yeah, so thank you. And Joanne, you as well, for coming to the meetings.
Great. So does anyone else have anything to add about what worked well? I did also want to say that I really appreciate Jason going through immediately and figuring out what strategy each proposal came under, because that way we did not have to do the work of teasing out which strategy it mostly was talking about, so I appreciate that a lot. All right, next, what needs improvement? What specific committee actions or decisions resulted in inefficiencies or created roadblocks for us to make recommendations about the opioid settlement funds? How did those actions or decisions not support our goal or detract from the goal? And then what resources and information are we missing? And Dawn, if you want to start.
So I think, for me, when we were all presented with the opportunity to work in the small group, there was very few persons. I think Jason said it was only 4 people responded of any interest of working in that small group. And then it appeared to me after the small group had done what it was asked, and under the timeline asked of us, because I had actually left several meetings to make sure that I was able to finish those, the review. Then it appeared that for me, none of that work had been reviewed, even though Jason has sent it out well in advance to remind everybody, I know we're over this long weekend, but here's this information for your meeting that's coming up, so that you will have time to review it. So it's very disappointing for me to go into a meeting thinking that we are on task. We reviewed in the time frame that we're supposed to, and now it's before the group that we are part of to look at what we've done and vote yes or no, and to hear that it had not been looked at all was disappointing. And then on top of that, to have the whole purpose of the meeting redirected and a new narrative formed from the comments of Dr. Jenkins and how it would affect county programming, to me was disappointing. And then when we came up with what I thought when we recessed, so that you could finally look at the work that was done and then come back and be ready to vote, then it turned into a totally different thing. Agenda had been changed, and all these different processes were going to be used for everybody now in the community to look at it. And for me, that caused a lack of trust. For me, in working with the group, a lack of trust in the community as to what we were really doing, whether or not we were looking for or to do what the community wanted done, or was there some personal preferences being overly pushed upon the group, and persons willing to follow that. So for me, it lost a lot of integrity. And I know a lot of you, most of you don't know me, but when I am put in a position and asked to make a decision of anything that's for the community, I take that very seriously. And what's important to me is that whatever process we use, that is being a process that has integrity and that can be trusted. And for me, that kind of got upended by how this whole process went in the end.
Mhm.
Agree. I think maybe. I'd say for me, it was more my personal experience of, feeling found and then lost. In other words, initially, I kind of thought we were kind of clear about what we were doing, what we were trying to accomplish, and I think, with the first step being what Dawn just described. And then, I'll just tell you, I still kind of, so I can't articulate it very well, I just got lost, I just got confused. And I really didn't know kind of where we're going and why we were doing whatever we were doing in that moment. It just seemed like things were changing in a way that I couldn't find the focus. I didn't know exactly, but, what was the pathway that we were following? And I think we were struggling to identify what that was. And there were some nuances, identified most of those, but I just got confused. And that's where I felt like, I don't know if I'm doing a good job here and that I can do anything effectively because I don't know what I'm doing. And so that was kind of my experience, going through this. And, it could have just been me. But then I know we all kind of said we struggle with the common word was process. Like,
Mhm.
which actually kind of positively speaking informs what needs to be accomplished. We just need a coherent, and consistent and easy to follow process. Because I think we're very capable of getting the work done. And I think in the end we did. But there were information that Don kind of referred to that was coming in that was confusing me. Like, why are we looking at this? We weren't looking at this before.
Mhm.
So, process would be some response. Which is good because then we can kind of figure out what we
Mhm.
think.
Yeah, I would second the confusion. I felt used to this whole process, which I think is partly because I haven't been in this type of role, this type of committee before, so a lot of it is me. And then this is obviously the first time that this committee has done a process like this, so some confusion probably inevitable. But yeah, and part of it probably was my own personal like listening and or reading comprehension issues. But feeling sort of a shifting understanding of our purpose and role as a committee from the beginning, where it had felt like sort of an underlying assumption that as the Opioid Settlement Advisory Committee, one of our primary, if not our primary functions would be providing this feedback and advisory function to the commissioners about the funding process. So then shifting from that kind of understanding of that as our whole body's goal, to understanding the process of having the small group who's really going to do the deep dive and provide the recommendations. And then the shift from that to back to the whole group. And then sort of while that shifting process was happening, also navigating, figuring out how to participate around feeling uncertainty around the conflict of interest situation. So yeah, just trying to, a lot of confusion, trying to understand what is the current process, and also just physically, or like materially, like the things that we were using, like trying to figure out like how Shalisa helping me see the actual proposals, which I couldn't figure out how to like open. Just like, just a lot of confusion.
Yeah.
But very thankful for everybody's like help and guidance and patience, helping us all kind of come together and just, get to an endpoint messily, as we did, and I think we learned a lot. The next one.
Mhm.
Thanks. I echo the confusion. I think that for me, we could have used like kind of the I would have loved to know the overall plan and timeline from the jump. I felt like, as often described, like, I felt like we'd come into this, I had anticipated being part of these decisions. Then we found out that it was just gonna be the small group, then we were asked again to vote on those. So I would have loved to know all of that from the beginning. And I would have also loved to know, more about like how these proposals were gonna, or how the, particularly how the proposals from the county programs were gonna be considered, because there were some that we were asked to weigh in on amounts and we hadn't seen the same kind of application from those programs. And so that was also confusing. Yeah, and I agree with what both have said.
Yeah, agree with the confusion. I think, yeah, just the lack of clarity on our role in the process, like you guys have said, I think was really like what set us up to have to change course partway through, because I think like a lot of us just didn't feel comfortable voting on something that we hadn't been involved in. And I personally was involved in the small group. But I think like the part of it that felt the most confusing to me was how, because we reviewed the applications with the rubric, we met, fairly briefly to talk it through everything and, kind of come to some consensus about general big picture. Yeah, we sort of like these proposals in these areas, but not anything about prioritizing those applications compared to the existing programs, how we would fit all the applications that we thought were sort of in the higher range into the funding that was available. So there wasn't really a process, and from my perspective, in terms of translating the scoring to the funding recommendation. And so then when we're asked to vote on funding recommendations, like we kind of had to do that to like make up that process, I think kind of at the last minute, which I think does lead to it seeming like we've changed the process and that making it feel like there's not trust both among us and also like with the community potentially viewing us. I think also the way that, I think programs had some communication to them about potentially you're gonna get this funding, but we hadn't actually we hadn't made the final decision yet. I think that led to a lot of confusion and maybe mistrust between us and the community as well. Just some smaller things I think would be helpful for the future. I mean, I would love it if we all if we all have the bandwidth and we all want to, like, I thought it was useful being asked to like do these recommendations, to like really go through the budgets, really go through the proposals. And it was nice to discuss all that with people. And I think it would be helpful just like for all of us to do that probably in the future, since like that is going to be if that is our goal, vote on something similar, then I think we all need to like really do a deep dive so that we can make sure that kind of we're on the same page as much as possible. I think one thing that like was frequently a question for me when I was reviewing the applications and the budgets was sort of what part of this proposal activity work is already happening, and to like what extent, and how is it currently being funded, and what is going to be something you're kind of starting from the ground up. And that's, sort of just like, where does this fit into like what the organization is already doing? I thought a lot of the proposals, it was really unclear about that. And it would have been really helpful to have that information. And I think like, yeah, just reviewing the proposals in detail, it felt like I had a lot of questions come up, like, isn't there funding available for this through Alliance? Or like, doesn't this other program already do this? Maybe I'm wrong, but I thought they did, and so just like having sort of a Q&A process in the application review where either we discuss questions that have come up in our initial review of the applications ourselves, or we kind of have a Q&A that can kind of go between us and the applicants that we get and then get feedback on, I think would be helpful to like really feel like we had a really solid sense of like what's being proposed and what the needs really are.
And I agree with what's been said, and I would say, looking back at like these April 18th minutes, like Jason received like 35 questions from the committee. And that was at the point where we were asked to look at what the working group had recommended and then vote on those proposals. It was pretty obvious that most of the committee members did not feel comfortable doing that. And so I agree, like it does, the way everything kind of played out, it did lead to, I think, us seeming like we had a lack of transparency, lack of integrity, people in the community feeling like maybe they cannot trust us in this role. But at the same time, it was pretty obvious that there were many people on this committee who just were not ready, did not feel prepared to make that recommendation from the working group. And so I don't know, how, I mean, some of the suggestions that you just made, Jamie, makes sense. Maybe that will help us, but I don't know if next time, if we're, do this again, if we should collect questions during the RFA while it's, while that process is still open and proposals are still coming, collect questions from the committee. And then see if we can find responses to them, but it just seemed like these were questions that folks maybe were sitting on or thinking about. And then when we were given the opportunity to send them in, it was sort of like a floodgate. 35 different questions asking things about what's the framework, what's the funding landscape, how are we gonna vote and deliberate, what are the program impacts, like, so for me, even though it was a very messy process, I feel like it's pretty obvious that there was definitely more information needed before folks could actually vote on the working group's recommendations.
Well, I agree with everything that everyone has said, and I would add that I think it was problematic that the working group, the representatives from the task force or the advisory committee were involved in the first part, but then it was like a mystery to me of how it ended up just being staff that actually came up with the final recommendation that came to us, and I didn't understand that. So I'm just gonna focus on what I think it would be good if we also talk about, like, what are our ideas for how to improve the process going forward? So that's what I'm just gonna focus on for my comments. Just based on what's happened and also just my experience on being in lots of boards and commissions and dealing with budgets a lot. I think that it'll be important that we start this process very early this time, and we should be able to, because, you know, last year it was new, and so we spent a lot of time, you know, getting briefed on things. So I feel like, I know we have on the calendar, you know, some informational things, but then I think when that stops, and we'll have to find out from Jason, when we, like, what timeline makes sense, but I think that having a planned timeline for actually the recommendation process, whatever. But I think that this advisory group should work together with staff on actually the decision-making rubric itself and get clarity on a lot of the issues that came up. For one, because the decision-making rubric itself is critical, and then that also impacts the RFP itself. And so I think we also have this amazing department now in Durham County government. I can't remember the name of it, but you know, John Kiefer's department, that after doing all the ARPA funding, you know, we had to deal with a lot of nonprofit funding applications, and they were so good at it. But the questions you raised, Jamie, like trying to understand, are we supplanting existing funding? Are there other sources of revenue you could be using, like Alliance or Medicare, Medicaid funding? Like, this is like a very important rule, like with our Durham pre-K program, we always say Durham County money comes in last. Like, you should be using every other source of funding you have available, and it's braided, and that we want to be using this money to leverage, right? That's to have the biggest impact. And I think also we should have some criteria around how much is going for personnel and salaries versus getting out into the community, what is directly benefiting and having an impact on people in the community. And, you know, some way of looking at that, like, what are the outcomes gonna be? What is the impact gonna be? I think another key thing is, and I will make sure that I push this on my end, Jason, your questions that you raised to the, because when Jason presented to our board, he had a list of questions, and I think one of the key questions that the Board of County Commissioners needs to give direction on is the use of the opioid settlement funding. Should it be just for community groups, or what percentage? And then there has to be a commitment that the funding for the county programs is going to be, we have to direct the county manager that that needs to then come out of the general fund. But that's a key policy decision that I think the Board of County Commissioners needs to make. So if the county commissioners say, we want the opioid funds to 100% now be used for the community, then that means the county manager is gonna have to find the money in the county budget, okay? And she needs to know that, like, right away, when they're starting to work on the budget. And then I think that will help with that clarity issue. That to me is really key. And then I think, so us being involved, in the rubric and some of these questions that frankly, you all are gonna have the expertise on, like Jamie, like you knowing about medication assisted treatment and being able to look at, like, that's where I think the expertise from everyone here is gonna be really important. And then I think we need to be clear about how the process, the RFP process, to what you just said, Jamie, is like the feedback loop. Normally, when there are proposals, there is the opportunity for county staff to ask questions of the applicant to get clarity, like so there's got to be a feedback loop where we can be able to ask questions and the applicant can clarify things. So for sure. And then I think, yeah, just, do we want to have everyone review the applications and then everyone score the rubric, also staff too, because, we do need staff expertise. So I think that the group should decide that process. And then I think, again, one of the problems is the confusion about communication, that there were some communications that went out to applicants before even the recommendation came to the advisory committee. So just being very clear about communication, I think is important. I think all of these issues can be addressed. They're all, to me, communication and process issues. And we absolutely can, I think, make sure that next year we are much different. So.
Can I ask a question, or should I hold from?
Go ahead.
Just, you're making me wonder, do we know, is this going to be a yearly process? Is the RFP process, is that decided at the MOA level? Is that decided by the commissioners? Is that decided by us? I know some RFPs are every 2 years, some are every year, some are every 5 years. Do we have a cadence that has been decided for how often?
Well, we could discuss that as a group, maybe we could say that we want the funding to be for 2 years, not 1 year, because it's a lot of work for nonprofits to have to reapply every year. I mean, that's something that we could talk about, right? Or do we have to do it? Can we do multi-year funding?
Yeah, you can do multi-year funding.
So again, that may be, especially if we decide, if the commissioners decide that this should be 100%, that the county programs will be funded in the general fund. If that happens, then we could say to people, we want you to submit a multi-year budget, right? Because, we understand, I mean, we could all understand it's a lot of work for everyone to have to go through this every year, to your point. So I mean, again, that's something that we could all talk about, right, with the help of staff. That's a really good point. Yeah.
And we
Yeah.
would need to discuss that pretty soon. I mean, because people would want to know before, too long, because March will be here like that.
Yeah,
Or planning, yeah.
so we might even want to look at the calendar for the subjects for future discussion. I don't know, and think about the timeline. And I think the other thing is getting absolute clarity on conflicts of interest, so that, because I feel like certain people you held back on, you know, like, I think that we want to be clear on that we do want everyone's expertise, and it's really only like a situation like you were in, that's a clear conflict of interest, or if you're on the board of something. But otherwise, that's the whole point of everyone being here.
So this last round, this is a great segue. The last round is about what we should do, what kind of specific action should we take next year? What should we do differently to improve how we make recommendations for upcoming processes, and what should we not do? Awesome. Don, do you have?
Well, we should, if this is the process where we are tasked with looking at applications, then we all should follow the same process. Whether we like whatever the rubric is or not, we all have to commit to following it. We all have to commit to being engaged in the process from the beginning. And when we're asked to review the information, come in willing and able to discuss why we should or shouldn't recommend something, be in a position to do it. So there needs to be consistency. Consistency breeds trust. Where I come from, anyway.
It's kind of hard to answer this right now without maybe fully reflecting on it, but because it's a big question. And I think we have some good thoughts, and I agree also with this, a tighter structure and maybe more realistic timelines. I mean, I felt like we were pushing things at certain points, and time was tight, and you know, so yes, I mean, again, all things that we can do. I think the other thing is we haven't really used the term outcome driven, like, you know, if we think about, for example, single year versus multi-year funding, should we be thinking about that in context of when you do stop and starts, I don't know how you're gonna have any outcomes.
Right.
So I do wonder if we ought to be thinking more strategically about promoting use of these funds toward ensuring that we're gonna actually have some measurable outcomes, because we haven't really talked about that very much. And I think it might be good to kind of add that into our process. That's one thing that comes. I'll give you that stuff, but there's more I can probably think about this.
I think for my own clarity, I would love to have just the entire, like every step of the process from the RFP being opened to the point where we hand our finalized recommendations to the Board of Commissioners. I would love just like a written out step-by-step process that, yeah, that we all understand ahead of time. That would be really helpful. That way we can, because I'm sure there's even, I think we did a good job of stumbling across a lot of things during this process, but I'm sure there'll be even other things that will come up that we haven't had a chance to stumble against so far. So, yeah, if we can figure out some of these underlying questions, like the priority of county versus community-based and the timing, 1 year versus 2 year or whatever, like, I think those are some foundational things that we kind of need to know to come up with that step-by-step process to inform how we move through it.
Yes, I agree that we need consistency, that we need. I also, for my own understanding, would love to have every step of the process written out that we can all understand it too. Something that I've been thinking a lot about is that what I would love ahead of next year, while we are in the process of hearing from community organizations about what work they're doing under the different strategies, if we would educate ourselves and one another about the strategies, like just sharing, even if it's just sharing resources about like, here are good practices or best practices in like MOUD prescribing, or naloxone distribution or whatever. That way we can we all have like a shared language or shared understanding, like a shared foundation to go from. And that way we're not asking community members to come in and tell us all about their work and what's happening largely across the board in Durham and justify their own existence with a pile of evidence. I think it would be great if we could commit to, learning together.
Yeah, sounds good. I agree with what's been said. I think the only thing I'd add would just be like making sure that part of the written out process includes like, how do we translate the scores like to funding? Cause I think it's like we could, say, okay, the top 5 scores get fully funded, or do the top 8 scores get partially funded? I think there's a lot of different ways we can approach that, and what we did this time around was one way to do it, but yeah, that seems like a piece of it that's a little bit like potentially arbitrary. We don't want it to be arbitrary, and we wanna like kind of know ahead of time like what we're doing with that.
I agree with everything that's been said before, and I think it would be helpful also to be very clear about where the decision making rests, right? So we've had a discussion briefly about multi-year funding and also doing some planning and everything for the RFP before the RFP is even released. And I would like to know, like, is that something the committee decides? Is it something that the county commissioners decide? Is it something that staff decides? Is it something that we working together as 3 groups decide? So I would like to come up with a set of like, not a bunch, but maybe like 2 or 3 questions just to help us get clear about who needs to make the decisions for us then to develop like a transparent, consistent process for the next time. Like, for example, are we even going to have an RFP process next year? Are we going to be involved in that review of those applications? So that's the biggest thing for me right now, besides everything everyone's has said.
Well, I can just tell you right now, the county commissioners or
County commissioners or,
okay, county commissioners we do not get involved with things like, we do approve, we will, like with the ARPA funding, we actually approved the decision-making rubric. And we were involved in the decision-making rubric, and that was it. So we were involved with the criteria, but that's the job of the advisory committee. Honestly, I perceive it to be involved with the actual decision-making rubric. I think the policy issue that county commissioners need to decide is whether how we want the funding to be used. Do we want it? What do you think, Jason?
Yeah, I'm not so sure. I can definitely give some clarity on that, but I just know from all my conversations with OSAC that, and across all the other counties, that all those decision makers do come from commissioners. In terms of.
Even the rubric, the decision-making rubric?
So like, I get all depends, but the commissioners could delegate that authority
Okay,
to a committee, they could delegate that authority to the staff, they could delegate that authority to. This or that person, then that would be the lay of the land for that specific county.
Okay.
So a lot of different counties do that slightly different, which is why I asked that question at
okay,
the commissioners.
okay,
That way they.
all right,
That delegated authority, but until
Okay.
that's delegated,
okay.
then there's no one that actually has that. rest of
Okay,
it.
well, obviously, we didn't follow that this year because.
I would just say most committees or advisory groups will bring your recommendation that you've come up with the decision making of how things would be in consultation with staff and whichever.
Yeah.
people that you will bring sort of your recommendations to the board.
Okay. But the issue is the decision-making rubric that the applications would be actually evaluated against. We need to get clarity on, I mean, maybe we develop it and then it just gets approved by the county commissioners. I don't know. Okay, well, we definitely have to get clarity on that because that didn't happen this time. But I do think a key is the issue that you asked about how the funds should be used. Versus county programs versus community camps. I was gonna also add to my comments that I think that it would be good for this group, also in partnership with staff, to talk about what is the criteria for evaluation, I mean, again, this gets back to the rubric. How do we measure, like you said, Paul, the impact, the outcomes, like what are we? You know, how do we, and so how does that get incorporated into the process? And then what kind of data are we gonna be asking to be provided so that we can be able to track that or measure that? And to your point, Brittany, about best practices, that could even be incorporated into the RFP, which is, you know, tell us about how what you're doing aligns with best practices.
Yeah.
You know, and that, so that could actually be part of the process.
Ethan, did you raise your hand just now?
Yeah, I guess like in terms of the evaluation process, so this is definitely for every single county, all the metrics are already kind of predetermined, already kind of preset. So we don't have to necessarily make up these type of metrics or measures, so. We are currently, since we've been doing 2 years so far with the oversight of the funds, we're actually going through the process with, the OSAC team to kind of help do the evaluation, just to bring a third party neutral individual in there. We also have our, John Paul, set up, you guys already met. Here's our data dashboard. He's also be a part of this process as well. Hopefully by sometime, I would say summer, this summer, we should have our first set of evaluation, by multiple evaluators from the OSAC team, as well as our epidemiology staff, from the county, that will produce that. And that could also, before we produce it widely, we can share with you guys, if you guys want to look at it, provide some recommendations and input. And then that's how we'll release it. Well,
So do you know, so yeah, so we have, so the programs that receive funding have all the same, it's the same for all the counties, so it's the same things that they're reporting on, for the outcomes. Is there anything like that that exists for a rubric for deciding on funding? Do you know, like something, rather than us coming with our own rubric? other
They
counties
are, yeah, just so it can be consistent across the state, they are looking at just like RI type templates.
Okay.
So they have not been developed yet. I do
Yeah.
know that they are. OSAT is developing drafts, so I actually help speak with them. They go across the county and they ask feedback as well. I know they're bringing up a ton of different things like that, so. You appreciate everyone's patience as OSAT is developing things, we're trying to develop things. Other counties are going through this RFP process very differently as well. We're also gonna follow the same structure that OSAT has already kind of laid out for all of the counties to hear. So there's still, and as they come up with stuff, I'm more than glad to share stuff, even like social media toolkits, things like that. They're all just sending a bunch of stuff out to us. So we're just kind of following with what they're also giving us. That's helpful.
I have a question about, so I know that we're talking about like making decisions, obviously not today, but making decisions eventually about like how frequently to have RFPs, and things like multi-year funding. I know that, Jason, you had mentioned that we don't know yet if we're gonna do an RFP next year. What is that process of finding that out look like? Like whose decision is that in essentially?
Yeah, I think the initial.
I would just say, what is it you all recommending, it seems as if it's allowable, but what you all recommending, then bring it back. Just, you know, just edit to make sure all our eyes are dotted and our teeth are crossed, but really guided by, you believe, you know, maybe the partners need more time to get things going, or if you want to do, annually for some other purpose, based on, you know, what you're receiving and what you want to see happen based on the outcomes and the services that you're funding.
Great.
And just so you know, the RFP does say that we are allocating funds up to 1 year, the option to renew it for a second year.
So it's already in there.
So it's already done.
So we could have renewal funds.
Great, thank you. And then, my other question was gonna be, so I know that like the state has come up with those measures that we will report to them on. Is it possible for us to, as, a committee, make recommendations about like a couple other, like additional measures for us to ask for from, funded programs? Or even like look through the measures list that the state provided to ask for a couple
Yeah, I mean, I think that's pretty challenging. One of the ways that we do that is we actually ask organizations, what are they already collecting? Because that's more of an epidemiological nightmare for JP and many others, to try to customize data per organization. And also, want to be very consistent across these are also organizations, so we can actually collect the data, but JP could probably speak to that a lot better than I could. So yes, there are some flexible metrics that are there. But that's difficult where as a staff, from a staff perspective, who has to manage all of those
Oh.
various organizations and all the different metrics. So, and it's also for organizations as well, so.
Yes, yeah,
I think the recommendations are great. I'm more worried about to take those and I would take us to the organization. And they gotta speak to the epidemiological staff who's managing these type of things, so.
yeah,
We have
totally.
to see what's doable for both the organization and for us.
Yeah, I would, yeah. Thanks. Yeah, that is definitely, I would never want to ask an organization to collect like extra data just for like, particularly if we only do this for like 1 or 2 years of funding. But definitely getting more insight into how their program is going. Great. Yes. All right. Any other thoughts about what we'll do next? Yes.
And this could actually be an agenda item for a future meeting, and that has to do with community messaging.
Yeah.
You know, the way in which we're disseminating our work and clarifying, the process, because I think, you know, we certainly want people to feel, like the point you brought up earlier, you know, people feel like they can trust us and that it's all transparent and they all kind of know, and I think maybe we could just be intentional about ensuring, I know we have a dashboard, we have these things that go out, that's great. Maybe just really kind of be mindful, of what do people need to hear and see from us so that they're kind of clear about this, and, you know, that there are no surprises for everybody. Because I, you know, you know, it is gonna be disappointing when people don't get funded and when they feel like, you know, they made a good go of it, and they did make a good go of it. But, you know, how do we, you know, anticipate people needing to understand, not everyone's gonna get funded or as funded fully as they might want to. Here's the reasons why, and here's how, you know, we go about our process so that it is fair and it is consistent with priorities, et cetera. And just maybe, you know, making sure that we're doing that as fully as we can, might be an opportunity.
Yeah.
Is it typical or is it in an RFP process, can or should we, are we able to provide the organizations who applied with their scores on the rubric that we use so that they can have that as that, whether they were awarded or not? Is that typical or not?
In the current RFP, it says that it's available for the request.
Okay, so it's not automatic, but it is accessible if they want it.
Yeah.
Okay, and that's sort of the norm, I don't know.
And, funder.
Yeah.
It depends on the funder sometimes. Sometimes they'll provide you with feedback, sometimes not.
Seems like a helpful thing for
Mhm.
programs to have.
Yeah. Right.
Yeah.
Anything else in our last 3 minutes before we? Sign? All right. So we will see one another again on August 12th. At 5 to 6:30.
That'll be in person or
Oh, on Zoom. That'll be on the internet. And we said earlier when we talked about our learning priorities that we'd like during the Durham Joins Together committee chairs, so the chairs of treatment and harm reduction, prevention and housing.
And there's, there's
Okay.
3 committees.
What's the?
So housing is now a new committee.
Okay,
Helen Ladd, who's our head of our community paramedicine program, she leads that. The harm reduction and treatment is led by Lacey Schofield and Tremaine Sawyer. And then education and prevention is Dr. Wanda Boone.
great.
Is it a Helen Tripp? Yeah, Helen
Oh,
Tripp.
I'm sorry. I've done that before, thank you. Yes, Helen Tripp.
Yeah.
Great. And then I will send, at a minimum, the National Association of County Officials. Put out policy briefs on, designed to support counties in making decisions about opioid settlement funds. So I will, at a minimum, send a link out to all of them, but also the particular briefs that correspond to each of these, like kind of specialties or strategies, so that we have that info going in. Jason, do you need anything from us? Are you good to invite them? Should we invite them?
I'm more than glad to do it.
Awesome, thank you. Great. All right. That's all I have.
Motion to adjourn.
Second.
All in favor, say aye.
Aye.
Thanks.
6:30.
Have a good July.
Yeah.
Thank you.
Very well facilitated.
It was very well participated.
Good work.
Thanks, everybody.